What is going on with these over-the-top 10-step skincare routines? Is anybody else seeing the madness everywhere? Do you really need that many steps, morning and evening? Who has time for all that? Is that really necessary? And oh, by the way, I bought one of those LED face masks. When exactly am I supposed to fit that into all of this? These are questions that you are asking. You're in the right place. If you're new here, I'm a board-certified dermatologist. In today's video, I am going to be breaking down the morning skincare routine versus the nighttime skincare routine. We're going to talk what's optional and how to make a routine that's simple, effective, and importantly, requires minimum effort so that you can actually do it. You can execute it. You can stay consistent with it. Spoiler alert, that is the only way to get results, because creams don't work if they're in the medicine cabinet unused. A little bit of background. Your skin has some slightly different needs depending on if it's in the morning or at nighttime. In the morning, the goal should really be focused on protecting your skin from the environmental aggressors it's going to be faced with throughout the day. And when it comes to skincare, that might lean towards antioxidants as well as the biggest player in the routine, the sunscreen. At nighttime, the focus shifts more to repair, to healing, and recovery. Your skin physiology changes up a bit. At nighttime, as we sleep, there's an increase in blood flow to the skin. With that comes an increase in what's called transepidermal water loss, making the skin more inclined to dryness as we sleep. But also because of that increase in blood flow, active ingredients that we put on the skin at night may have a better chance of making their way into the skin. Because your skin renews itself as you sleep, this is a time to focus on cleansing as well as hydration, rich moisturization, barrier repair, and applying certain active ingredients if you so choose or if they're indicated for you. And yes, red light, it can fit into this routine. We'll talk about that more in a moment. Let's start with the morning routine. First up, just a simple, effective routine when you wake up in the morning. As the first step, wash your face if needed. If your skin is oily or sweaty, you may benefit from washing your face in the morning. Otherwise, for other people, a splash of water may be needed just to kind of refresh yourself a bit and hydrate the top layer of the skin. Whereas for other people, especially those who are dealing with extreme sensitivity, burning, stinging, redness, flare-ups of rosacea, maybe you're in the midst of a dermatitis, you might want to back off on the morning cleanse and just go into a bare face with the next step. So step number 2 is up to you. Ooh, I made a rhyme there. And that is if you are using some sort of antioxidant serum, whether it be a vitamin C serum, a niacinamide serum, a serum with glutathione, that's a good time to apply that in the morning. That way you have those antioxidants on board. What they're going to do is help your skin fight off free radicals. After you apply that, if you so choose, because that is not a requirement for an effective skincare routine, it's just something people like to use and may offer some benefits. After you apply that, you might want to apply a moisturizer if your skin tends to be dry. However, that's a step you can skip. The next step is arguably the most important step in your daily skincare routine. Once the skin has dried completely, like it's no longer damp to the touch, then you want to apply sunscreen. And you want to apply it liberally, making sure to cover all surfaces, the face, the neck, the ears. One of the reasons sunscreen fails is you don't apply enough of it. Check out my video as a side note on why sunscreen fails for more pitfalls that you may be running into. I suggest looking for a sunscreen with an SPF 30 or higher. If it's a day that you plan to participate in outdoor activities where you're going to be out there for a while, working up a sweat, I do suggest a water-resistant formula. Also, if you live in a very humid climate, you might want to choose that as well. But for days when you're mostly indoors, running in and out, running errands, going out to get the mail, SPF 30 is fine. Even if you don't think you're going to be outside much, you still should be in the habit of putting sunscreen on daily, because those little incidental exposures, cumulatively, they add up. And the studies that we have on the benefits of sunscreen use show that people who use it daily, they get the best results in terms of preventing premature signs of skin aging as well as skin cancers. Here's a little insider secret though. If you want to keep the morning routine as minimal as possible, like, I don't want to do anything. For some people, this is an option. Wake up, put sunscreen on, you're done. A couple of things about this approach that people don't realize, they don't take into account, because they think, well, don't I need this? Don't I need that? Sunscreen packs a lot more than just the ultraviolet radiation protection, which of course is the most important aspect of it. But sunscreen is in a moisturizing base, which will help to reduce water loss as you go throughout the day, keeping the skin from getting dry, flaky, and easily irritated. Sunscreens often contain antioxidants such as niacinamide, one of the most evidence-based cosmetic ingredients out there, in my opinion. There is a lot of clinical data on its benefits. It's in a lot of sunscreens already. already. So you get a product that is delivering that antioxidant, it's moisturizing the skin, it's protecting the skin, and you just need to apply one thing in the morning. Another perk of this approach that I want to emphasize is, like I said, one of the reasons sunscreen fails is that people don't apply enough. By only putting sunscreen on your face in the morning, it gives you more time to apply it correctly, to apply it liberally, to take your time and make sure you don't skip areas. This is the most important thing you can do for your skin in the long run. All right, let's look at the nighttime routine. Again, at night, that's really when a lot of the repair processes are getting kicked off. You have more transepidermal water loss. Remember, you've been exposed to environmental aggressors, and even though you had the antioxidants, you had the sun protection, there's still, some degree of environmental aggression that has gone on, and you have these like free radicals that your body's trying to deal with. This is a great time to lean into hydrating, repairing products. Here's a simple step that works for most people. Step number 1, cleanse your face. Everyone should do this at the end of the day, especially if you wear sunscreen, which you should, okay? Everybody should be wearing sunscreen. Also, if you wear makeup, people who wear makeup, or even people who are just wearing sunscreen, as should be everyone, you may find that you like to do a double cleanse. That works really well for me. I find it's great for removing, in particular, the mascara, okay, around my eyes. And that involves an oil cleanser step first that you smear all over your face to break up the film of cosmetic residue, and then a gentle cleanser to wash it all off. Not everyone has to do this, but it does help quite a bit, I find, in the act of makeup removal. Effective, efficient makeup removal that minimizes the need to rub the skin too much, which ultimately can irritate your skin. But again, this is not necessary. You could just use a mild cleanser, and you don't necessarily have to do the double cleanse, but you may find, again, if you wear a lot of makeup, the double cleanse can be a great option. Step number 2 is going to be more focused on any actives that you might elect to be using. Specifically, one of the most evidence-based ingredients out there with a long-standing track record of efficacy for a variety of skin issues, and that's going to be a topical retinol. Retinol is just an umbrella category for forms of topical vitamin A, which when applied to the skin can improve the visible signs of skin aging, can improve collagen production, lessening wrinkles, can help clear up hyperpigmentation, can treat acne. Now, I've got lots of videos clarifying the differences between all of the different ones, but for brevity's sake, we'll just say retinol as a category. If you're going to use one of these, this is the time to apply it. You want to apply this after cleansing. You can apply it to the skin if it's damp. That will enhance penetration. But because these ingredients can be irritating, that might be too much for you. You might want to pat dry the skin a bit. Check out my video on how to minimize irritation from retinol. I believe I point that out there as well. But for many people, they just put it on to the damp skin and that's it. Another thing a lot of people pursue, especially in the first few weeks of introducing retinol into their routine, like if you're new here, you're new to skincare, and you're thinking of starting the retinol, there's a lot you need to know about it, but it does cause some dryness and irritation and peeling in the first few weeks. So to reduce that, a lot of people pursue the moisture sandwich method. So the moisture sandwich method is a great option here, and the way to do that is to apply a lightweight hydrating serum or your lightweight hydrating moisturizer as a first step after cleansing, then apply the retinoid, then apply another layer of moisturizer. This moisture sandwich approach really does help to reduce dryness and irritation. Some people refer to this as buffering the retinoid, but once you've been using it for a long time, you may find that this is just too much. You no longer need to do that. I personally don't have to do that myself. I could just put my retinoid on to a bare face. I also want to talk about chemical exfoliants here, when to use them. Chemical exfoliants include salicylic acid, as well as alpha hydroxy acids like glycolic, lactic, mandelic, and then there's polyhydroxy acid, which kind of are hydrating as well as very, very gentle exfoliants. When should you be using these in this routine? My number 1 tip is to use them as frequently as the product tells you to, because you'll find on the internet all sorts of arbitrary made-up rules about only exfoliate on Tuesdays and Thursdays, never exfoliate daily, and all of that is hogwash because the frequency with which you use any chemical exfoliant that you buy as a cosmetic without a prescription or an over-the-counter medication in the case of salicylic acid, it's going to vary as far as the frequency depending on the product and you, the individual. For example, salicylic acid, many times, especially if it's pursued for the treatment of acne, is applied twice a day, every day. None of this every other week kind of a thing. Like, to get the results people need from it, they often need to apply it twice a day. The alpha hydroxy acids, glycolic, lactic, mandelic, depending on what it is you are going after, the product you're using, they may be used twice a day, they may be used once a day. As far as whether to use them in the morning or the nighttime, you could use them either time, or again, sometimes you might be using them twice twice a day. Now, if you're using a topical retinoid and you're new to using a topical retinoid, I don't suggest applying an exfoliating acid along with it in the first couple of weeks because that can cause more dryness and peeling and irritation. But for people such as myself who have been using topical retinoids for a long time, it's not a problem to put your topical retinoid on and then put on maybe your glycolic acid or your salicylic acid on over it if you so choose, or you might just want to put that on in the morning depending on how frequently you're using it and how your routine works out. Not only should you be following the recommended frequency that the product guides you on, but also pay attention to your skin, right? Like if you find that using it daily as it is advised is drying out your skin, you're getting a lot of peeling and irritation, then back down. Okay, that's a situation to reduce the frequency for sure. But if you're doing it so infrequently because somebody on the internet told you to, you might be missing out on the true fullness of the benefits of that particular ingredient. The final step of the nighttime routine should be, in many cases, to apply your moisturizer. Again, moisturizers are really helpful here. They help to reduce transepidermal water loss, optimizing water content in the skin, which ultimately can, in the long run, reduce your need to exfoliate in some cases because skin naturally exfoliates, but that gets slowed down when the water content drops due to dehydration, dry skin. We optimize water content, then the enzymes that maintain barrier integrity and exfoliate the skin naturally can work more efficiently, and you may find that your skin overall becomes smoother, more supple. Plus, the improved water content also helps to diminish little fine lines that I refer to as dehydration wrinkles. And importantly, moisturizers help to reduce side effects of dryness and peeling and irritation that you might experience from your topical retinoid. But here's the thing, with the moisturizer as the final step of your nighttime skincare routine, you might not even need to use the moisturizer. Not everyone really feels as though they need moisturizer. Some people, their skin naturally retains moisture a bit better. They don't feel like their skin is tight, dry, flaky. They're not having symptoms of sensitivity, burning, stinging, redness, and they're not, getting those little dry wrinkles. So they can skip a moisturizer. And if you're using, say, for example, tretinoin cream as an active, the cream for a lot of people, the cream base is sufficiently moisturizing. They're applying it all over the face. They're like, I don't really need the moisturizer on top. Fine. The less you need to use, the better. Okay, it just makes it easier to stick with so that you can get the best results. But for a lot of people, using a moisturizer at night is a game changer. And how do you know if you should use a moisturizer? Well, if your skin is feeling just kind of tight, a little squeaky, if you will, at this point, it's a good sign that maybe you would benefit from a moisturizer, like it's already a little dry. And be mindful of the fact that your need for moisturizing can change depending on the time of the year. It tends to be more of a winter sport, if you will, the need for moisturizing with the drop in humidity and the heaters coming on. But it's also a life stage thing. For example, women, as they go through menopause, their skin is a lot more inclined at that point moving forward to become dry, to lose water. So richer night creams become, more of a staple. Be on the lookout for how your skin is doing. Now, where does red light therapy come into play? If you're not familiar with red light therapy, check out some of my videos on it. But red and near infrared wavelengths of light, they work through a process known as photobiomodulation to reduce inflammation in the skin, to help improve circulation, and as a result, the delivery of nourishing growth factors to the skin. And importantly, they help to stimulate fibroblasts in the deeper layers of the skin to produce healthy collagen. But when should you use one of these devices? As far as whether to use it in your morning routine or your evening routine, it's really up to you. There's no wrong time of the day. But the key is your skin should be completely clean and bare. You don't want to put the mask on, for example, over freshly applied serums, lotions, creams that are still damp to the touch, because this can increase irritation simply because you are occluding these ingredients under the mask. That increases the likelihood of irritation, especially if you're using ingredients that at baseline have more of a tendency to be irritating, like your alpha hydroxy acids, for example. And it also helps the light penetrate more evenly, more efficiently. So a lot of people like to use their red light masks first thing in the morning before they even start their skincare routine, because their face is clean from the night before. They don't have any damp, freshly applied product, and that way they do the mask and then they're ready to move on to their morning routine. Whereas other people like to do it at night to kind of unwind because it does kind of relax you a bit. I think that's all in my head, but I do find it relaxing to do the red light masks. So a lot of people like to do them at night for that reason. So after you've cleansed your skin, you might want to pat it dry and do your mask then, and then follow the routine as I suggested with whatever else you want to put on. Just put it on after the mask is done to clean skin. An important note though about your red light masks, you want to use them as frequently as the manufacturer instructs. Don't just use them every day thinking that you're going to get more out of them, because in some cases you might actually be sabotaging the results that you get from them. There is this theory that using certain masks too frequently, depending on how they're dosed, you can actually end up sabotaging the results because you kind of need a little bit of a breather, a little bit of a wiggle room in between treatments. That's why a lot of masks are not intended to be used daily. And that'll vary from mask to mask. For those of you out there who think skincare routines are hogwash, let's talk the bare bones, the bare necessities. Like, what can you get away with that requires the least amount of effort? I know you. I know you're out there. You're like, either you don't have time or that's just not how you want to spend your time. You're not really interested in skincare. You just want to do the basics. Here's what I recommend. Morning, wash your face if you feel like you need to. Like if your face is oily or sweaty, or just splash some water on it if you feel like that helps. If you don't feel like you need to wash your face in the morning, then do the wake up, put on sunscreen and go routine, okay? As long as you put sunscreen on in the morning, that's perfect, all right? That's the main thing that you need to focus on. Sunscreen in the morning liberally to all surfaces of the face, the ears, and the neck. And keep in mind, the sunscreen that you put on in the morning, it may be offering you those antioxidants depending on the formulation, and it's a moisturizer, okay? So you're getting quite a bit out of that one product. Then in the evening, wash your face. I do suggest everyone wash their face at the end of the day to remove oil, sebum, any cosmetic residue. Of course, if you wear makeup, you definitely need to, but aeroallergens, pollens, and things of that sort land on the skin, and they do contribute to inflammation, irritation, and it does help to exfoliate the skin just to wash it. And when people abandon facial washing, like they stop washing their face, you can actually get overabundance of the little mites that live on your skin called demodex, and you can get these little bumps, these little rashes, and you also can get a skin condition called dermatitis neglecta from not putting anything on your face. Like the skin just kind of builds up and takes on this cornflake-like appearance. So yeah, I do suggest everyone wash their face at the end of the day. And honestly, that's something that you can even accomplish when you, assuming that you bathe at nighttime, that's something you accomplish in the nighttime routine in the shower. So then apply a moisturizer if you feel like your skin is tight and dry and you would benefit from it. Otherwise, skip that and you're done. No serums, no treatments, no nothing. I mean, if that is how you want to go, that is not wrong. Okay, you're not wrong to follow that routine if it works for you. To wrap it all up, the morning routine is focused on protection. The nighttime routine is focused on barrier recovery, moisturization, hydration. If you're going to use a retinoid, apply it as the first step in your nighttime routine after cleansing. Or if you're going to use some sort of lightweight toner or hydrating essence underneath as part of the moisture sandwich, you could apply that first and then the retinoid. Follow up in the nighttime routine with a moisturizer as the last step. Use exfoliants according to the product directions, and they can be used in the morning and evening. That's kind of up to you and what works out well for you. Red light therapy is a great addition. Use your device at the frequency dictated by the manufacturer. Just make sure you use it on clean, bare skin. A minimal routine can be very effective. You don't need an over-the-top routine. And just because someone has an over-the-top routine, talk to them in 3 weeks. Are they still doing it? Yeah. Fewer products means more likely that you will stick with it. And in that case, there's a better chance that you're going to get good results. All right, guys. So that is a breakdown with regards to the morning versus the nighttime skincare routine. Now in this video, I touched on the skin minimalism routines quite a bit. On the Insulate, I'm going to put a video that I did recently in case you missed it, breaking down the benefits of skin minimalism, keeping the routine to a bare number of products, the advantages that that can have. So watch that one next, especially if you are looking to build a skincare routine. I think you will find that eye-opening and wallet closing, which are two actions that we like. All right, guys, if you enjoyed this video, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.